There are many safety issues in nursing, especially now with the national nursing shortage we are having. In this presentation, I am going to discuss the issue of a shortage of experienced nurses. By the end of this presentation, the learner will be able to do the following: explain the influence of this issue on nursing practice, identify how healthcare is impacted by the shortage of experienced nurses, and identify how society is impacted by the shortage. So before we talk about the issue of having a shortage of experienced nurses, we are first going to define what the experienced nurse is. So, an experienced nurse is a registered nurse with a formal university or college education and with more than 1 year of practice in a particular area, and or an RN with additional training or certification in a specific nursing practice area. For example, a nurse who has a certification in med-surg, or if they're certified as a critical care nurse. Now we're going to see how the issue of inadequate or the shortage of experienced nurses influences nursing practice. The first topic is nurse burnout, and that is something that leads to the experienced nurses leaving the hospital. And if we take a look at the definition, burnout is the frustration, loss of interest, decreased productivity, and fatigue caused by overwork and prolonged stress. Nurse burnout affects up to 83.3% of nurses. There's a very high prevalence of that in nursing. Nurse burnout has a lot of poor outcomes. It leads to low staff morale, high absenteeism, high turnover rates, and occupational injuries. If I just take a look at my unit that I work for in the hospital, I could see that we don't have a very high percentage of experienced nurses. We're working with a lot of young nurses in the hospital. So I did calculate the percentage of experienced nurses for our evening and night shift, and that was 45%. So now we're going to talk about how the shortage of experienced nurses impacts healthcare. The top issue in healthcare here is safety, and that's always the number one thing on their mind in the hospitals. So having a lower group of experienced nurses on the floor gives you a higher chance of having sentinel events. Research shows that higher staffing levels of experienced RNs are linked to lower rates of patient falls, infections, medication errors, and even death. So that's a pretty strong statistic there, and it's just worth it retaining your experienced nurses for the safety of your patients. The other point here is poor nurse retention. So we're not keeping our experienced nurses, we are losing them and gaining newer nurses. So many experienced nurses are leaving the hospital practice due to the negative working conditions. And new nurses are also leaving. They say most new nurses leave within a year after having their first job. So the main way this issue impacts society is that quality patient care is increased with experienced nurses. So if you think about it, patient care, the quality is decreased the less experienced nurses you have. So what are the quality indicators that they measure for this? That would include things such as fall rates, injury fall rate, catheter-associated urinary tract infections, pressure ulcer prevalence, as well as hospital-acquired pressure ulcers. So those are things that they look for to measure the quality of the patient care. So studies show that there's a higher percentage of experienced nurses, and this leads to lower fall rates and lower hospital-acquired pressure ulcer rates, which are two main quality indicators. Data also shows that for every increase of 1 year in an average nurse's experience, the fall rate is lowered by 1%. So in closing this presentation, I want to leave you with a quote from our mother of nursing. She said, Florence Nightingale, "The very first requirement in a hospital is that it should do the sick no harm." So safety first. We want to keep our patients safe, and we want to keep our experienced nurses on the floor. Fight to keep, and so I say, safety first. Fight to keep your experienced nurse. Thank you guys for listening to my presentation.